I think that this Ford government is going to do everything it can to push the boundaries and try to ensure that their friends are able to, make as much private profits off of our public dollars as they can in healthcare. And that's something that I think is clear from this.
The Ontario government is facing questions today about its plan for the province's healthcare system. That's after the NDP leaked a draft bill called the Health System Efficiency Act. It proposes creating a super agency that would replace local health authorities. The NDP says this throws open the door to privatization. So is that the plan? Christine Elliott is Ontario's Minister of Health and Long-Term Care. She joins me now from Queen's Park in Toronto. Hi, Minister Elliott. Great to see you.
Hello, Vashi. Thanks for having me join you.
Thank you so much for your time. Yesterday, the NDP released a draft copy of the Health System Efficiency Act, which the party had obtained. It may just be a draft, and I totally understand your point that the government has been making, that it is just a draft, but is your government planning to or considering either reducing the number of local health authorities or getting rid of them completely?
Well, it is a draft, you're correct, and it has yet to be finalized, but we are looking at transforming our healthcare system into one that is truly patient-oriented, one that responds to patients' needs in a timely way and coordinates their care throughout their lives, and that's modernized and brought into the 21st century in terms of technology and communications.
Does that mean that you would consider reducing the number of LHINs or getting rid of them altogether?
What we are doing is making sure that we are putting as much care as possible on the front lines. That's what people have told us that they need and want. That's why they elected us, and that's what we are doing within, I must add, our public healthcare system. People will continue to pay for their care with their OHIP cards.
Is there a problem in which your government views? Does your government view the current method of delivery, the current LHIN system, administrative system, I should say, as problematic? Do you see any issues with it?
We certainly know that there aren't enough resources on the front lines where people need service. For example, we have 32,000 people in Ontario, seniors who are waiting to be admitted to long-term care homes. We have 1,200 people every day in hospitals across Ontario that are receiving care in hallways and in storage rooms and other inappropriate locations. And I can tell you that actively engaging in our mental health and addictions consultations, we have thousands of people who need access in a timely way to programs and services. I've spoken with parents who have sons or daughters that have significant mental health challenges, including suicidal thoughts, and to be told that you cannot receive services for a year is totally unacceptable. We want to help people with those problems and concerns, and that's what we're concentrating on with this transformational plan.
I want to be clear, though, am I to read between the lines there that you think that money that is going, for example, towards the administration of the system through LHINs would be better diverted to the front lines?
It is about more frontline care, absolutely. We are spending right now $61 billion on healthcare in Ontario, yet study after study shows that we're not getting good value for those tax dollars. We want to make sure that we maximize the use of every taxpayer-funded healthcare dollar as possible and make sure that we put that money into frontline care where people need it.
Will there be any cuts to the health budget in the upcoming budget?
We are looking at finding efficiencies in our healthcare system, and I have said many times that we are turning over everything within the Ministry of Health and the way that the ministry and government is delivering services to make sure that the money that we have is going to be well spent.
So that means you haven't ruled out, in finding efficiencies, making cuts to the overall health budget?
We are looking at a $61 billion budget. I am confident that we will be able to find the efficiencies within that budget and that we are going to deliver better health care to the people of Ontario.
If you were to quantify finding efficiencies, and I understand you haven't found them entirely yet, but I'm sure you can understand what I'm getting at, because the NDP, the opposition, has accused your government of inflating, for example, the deficit figure at $15 billion to justify drastic cuts. When you say we're going to find efficiencies, for Ontarians who are watching tonight and wondering if that means that healthcare cuts are coming, is that just a few small efficiencies worth a couple $100 million, or are we talking billions of dollars off a $61 billion budget?
The NDP, unfortunately, are really fear-mongering on this issue, which is really a shame, because this is the most important issue to most families in Ontario, their healthcare system. And I want to ensure all of the people of Ontario that we want to increase services for them, that we want to make sure that we can resolve the problems that they're experiencing. This is what we're doing, and we're doing it within our public healthcare system.
With respect, Minister, that doesn't answer the question about what you mean by finding efficiencies. Do you mean a couple $100 million of efficiencies, or do you mean billions of dollars could potentially be shaved off the healthcare budget?
We are looking at everything that's being done within the ministry. There are ways that we can make our services more efficient, procurement, other ways that we're taking a look at. But what we're not going to scrimp on is delivering quality services to the people of Ontario, better services, more frontline.
And just before I let you go, the reason that I guess the NDP made the leap to privatization, or some of the justification that they gave yesterday, was this idea that you would eliminate the LHINs, create a super agency, and that super agency would contract out some of the services that are in addition to what's currently privately delivered, such as like blood tests, let's say, or x-rays. Is your government entertaining the option of contracting out some health services?
No, that is absolutely incorrect. And again, part of the fear-mongering that the NDP is engaged in. What we want to do is enhance our public system of healthcare and make sure that those services are delivered in communities across Ontario to the people that need that help.
So you've ruled out, for example, say something like MRIs, they wouldn't be privately done by private companies. You're not looking at extra?
No, absolutely not. We want to enhance our public healthcare system.
All right, thank you, Minister Elliott. Really appreciate your time tonight.
My pleasure. Thank you.